Well, welcome. I would like to introduce a friend of mine. This is Brad Murphy. He's a veterinarian at the Vestavia Animal Clinic in Vestavia. We have had so many questions regarding animal CPR. And as you know, we do human CPR, and we don't do the animals. So I thought that I would bring in an expert. And that is why I asked Brad to join me. Brad, thanks for coming in.
Sure thing, yeah.
I appreciate it. Tell us a little bit about your background, where you went to school, how long you've been a veterinarian.
I went to Auburn University College of Veterinary Medicine.
War Eagle.
I graduated in 2000. Came to Vestavia, the Birmingham area, right after graduation. Actually did my terminal preceptorship, which is a residency you do at the end of vet school there. Started my employment in June of 2000. And I've been there ever since.
Been there ever since?
Absolutely.
Excellent. Now, I know that they're going to want to know, too, so how many pets do you have?
I have a very allergic daughter, so I have no furry pets at home. Very allergic to dogs and cats. But I have feathered pets. I have chickens, the pets that can give back.
Hey, there you go. I always heard that those eggs are much better.
Absolutely, I'm ruined.
Better than the store. You're ruined for good.
Ruined.
Yeah.
I'll never be able to get, well, yeah, in a pinch, but, you know, great eggs.
Well, Brad has brought some friends with us today, and he's going to introduce them here, and he is going to show us how to do dog CPR.
Absolutely.
Brad, why don't you tell us the names of your friends here?
This is Abby, and this is Schultz.
Abby and Schultz. Hi, guys. How are you doing? Yeah? We thought that these guys would probably be the most well-behaved while we're trying to show you these things. So
yeah, and then you bring up a good point. And as far as live animals go and doing something like this, as far as the practice goes, never something you want to do on a healthy live animal.
Okay.
Because you could cause some irreversible damage. And of course, talking about assisted respirations, most live healthy animals aren't going to let you put your mouth on their nose.
Sure.
So that's something that might be dangerous. So and you can cause irreversible damage to the ribs or the heart by doing chest compressions on a live healthy animal. So we won't want to do that. But there are things that we can do to practice before, which we can talk about.
Okay. You also mentioned before, and this is the same thing even with humans, you have to know the difference between what is normal and what is not normal.
Right.
So you said that there were some baseline things that we need to...
Right, things that you want to do before you're ever presented with an emergency situation. You want to assess things at home when everything's fine. And two things that you need to do, and that's watching respirations, watching your pets breathe so you know what's normal. And that can be done when you're sitting on the couch watching TV and they're on the floor or on the couch with you or in the bed watching TV at night. Okay. You're looking for a rise and fall of the chest. Which is pretty straightforward, not hard to detect. You can see that from across the room. But you want to see what that looks like normally. And checking a pulse. And it's not, on people, we've all felt our own pulses. It's very similar to the way that it feels, but it's in a different location. On pets, the best way to feel a pulse is inside of the thigh, right on the inside of the back leg. And do that when you're hanging out to find it. Because
so that's high up? So on a smaller dog?
Mm-hmm.
Okay.
Yeah,
so on a bigger dog, it's going to be up high.
Very close to where the abdomen meets the leg.
Okay.
So inside the back leg, a light touch, you can feel it bound, just like your pulse you feel at home. There are other places that you can feel it, but that's the most easily felt. You can also put your hand on the chest and actually feel the heart beating on the chest in the smaller dogs. The big, deep-chested, the Great Danes and big, round boxer dogs that have the big, round chest, sometimes it's difficult to feel. Really, really fluffy cats, sometimes it's difficult to feel. But inside the back leg, there's very little hair. Very easy to feel it.
Okay, there you go.
Yeah, those criteria are met that you don't see a rise and fall of the chest and you don't feel femoral pulse. And at that point, you've got two options. And it really depends on how accessible you are to a veterinary clinic. If you're out in a remote area and there's no possible way you can get to a veterinary clinic, you have no other option but doing this right then and there. If you're close or you have somebody that's with you that can make a phone call, the Annie, are you okay, help,
Sure.
and the kind of thing. If you've got somebody with you that you can make a phone call or get in the car and get it ready, the best place possibly for you to be is at a veterinary clinic. Because there are true advantages being in clinic where you have access to oxygen, where you have access to assisted ventilation through an endotracheal tube, where you have emergency drugs, and we have a staff that are able to come in and within 2 minutes get everything started on pure 100% oxygen, somebody breathing, somebody doing emergency drugs, and somebody doing cardiac compressions. That's vastly superior, and you're going to have a lot better outcome in a clinic situation than you are going to be at home or wherever you are. But if the worst possible scenario happens and you can't do that, then starting CPR at home is what you do.
So if you have the means and you're ready, the best thing to do is to get them to the vet,
Absolutely.
to get them to the clinic.
Absolutely.
All right. Let's say that for some reason we don't have means, whether our car is not working, we don't have transportation. What would be the next thing that we could do?
So you're going to look for respirations. You can look for the rise and fall of the chest. You're going to check for a femoral pulse. If both of those are absent, we're not breathing, we don't feel a heartbeat, you do the ABCs.
Okay.
So A stands for airway, B stands for breathing, and C stands for circulation. Airway first. You want to assess the airway.
And we talked about this before. Remember, that's different than the humans.
Yeah,
the humans is CAB now, but you guys knew that because you guys took the class.
Yeah, but it's still ABC.
ABC's on animals.
Easier for us to remember. Yeah. So you want to assess the airway, and doing that, if they're out, okay, we've lost consciousness. Typically, we're going to be on our side. You want to assess the airway so you can make sure that the airway is clear. So unconscious animals, it's not very difficult at all to extend their tongue. So you want to grab their tongue and you want to look in their airway, making sure there's nothing there, sticks or bones or leaves, making sure the airway is clear. Because if there's something stuck in the airway, that could have caused the unconsciousness and the cardiorespiratory arrest. You want to make sure that that's clear. So pull out the tongue, look. If there's anything in there, rake it out. Don't go too far, but rake out the mouth. Anything that might be.
So just so where you can see, you're not.
Right, we're not reaching down any farther than the back of the tongue. You just want to make sure there's not something stuck in the airway. After that's clear, we want to do 5 respirations. And it's different on humans than it is on dogs. If you try to breathe in their mouth, it's just going to escape and go everywhere because they have such big jowls. They have a long snout. So when you breathe for dogs, it's mouth to snout. It's mouth to nose.
Mouth to snout.
Mouth to snout. So if you were to just breathe in their nose, the air would come out of their mouth.
Come out of their mouth.
So
Okay.
you've got to close the mouth up, and you got to use both hands, depending on the size of the animal. Okay. So when you're breathing for the animal, most likely they're going to be in their lateral recumbency. You've checked the airway. You've pulled out the tongue, made sure the airway is clear. You have to close the mouth off. So in a cat, it's more of a put your hand over their mouth and close, because you can't get 2 hands on a cat's mouth. Closing over their mouth to keep the air going into the lungs rather than out of the mouth when you breathe into their nose. On the dogs, 2 hands around the snout, pushing those lips over the mouth, holding things closed, just like that. And it's mouth to snout. That's how you want to breathe for them. And it's enough breathing pressure to see the chest rise. So holding over the mouth like that, however you want to do it, to get your hands to get those lips closed, and mouth over the snout, looking at their chest. And you can use quite a bit of force. What you're looking for, you want to use the force that causes the chest to rise. Big dog, Great Dane, is going to require obviously more lung strength. It's going to require a harder blow than it is.
But you're almost in a good position. If you're
Absolutely.
here, you can see the chest.
Mm-hmm.
Okay.
And when you're doing this, you don't want to be tilting the neck in any way. Head extended is the best way to get good airflow.
Okay.
So you want the head extended, and that's something if you were doing any of this in the car or in a situation
Now, when you
where
say in the car, you're not driving and doing this.
No.
This would be the
That
other
would be
person.
the
No
ultimate-
texting and
no
driving, no dog
distract-
CPR and
right,
driving.
that's
Okay.
right.
Just
So
making
you're in
sure
somebody else
everybody
is driving.
understands. All right, we're there.
and then you're in the back seat doing this, but you want to make sure that head is extended.
Extended. Okay.
No, if you're like this, the air's not going to flow as well.
Okay.
So you use enough pressure to see the rise of the chest. After the airway, that's the breathing, and then you're doing circulation. So initially it's 5 breaths to get oxygen into the lungs.
Okay.
Because it's not going to do any good for us to do chest compressions without any oxygen in the lungs. Okay, and that's different for you guys now.
Right.
But moving on from that, after you do the breathing, 5 breaths to start, and then you're doing chest compressions. And where you do chest compressions, on people, we're ventrally dorsally
I was going
flattened.
to say, we talked about this. We are this way.
Dogs are this way.
Dogs are opposite.
Right. They're flattened laterally. Their chest is like this. And to do the compressions, it's opposite. So you're doing it from the side rather than from the front. And where the heart is in the dog, just to talk a little bit about anatomy, if you were to take the elbow and hold it up against the body, so take the elbow and hold it up against the body, against the chest, the heart is right underneath the elbow.
On the left or the right?
Either.
Either?
Yeah, either.
So it's just right in the middle?
Right in the middle.
So it's right in the middle.
You can do chest compressions from either side. They don't have to be in any specific way. The chest kind of sits right in the middle of the
Very cool.
thorax, right behind the elbow.
So that's the good gauge. On a big dog, it's going to be back a little.
It's a little bit different as far as chest compressions go on a big dog, where you do it, because it's very difficult to get to the heart on a big dog because they have really, really firm rib cages. Hard to get direct compression. On a big dog, you're essentially looking for the widest point of the chest.
Okay.
So that's where you do your compressions. In a small dog or cat, right behind the elbow. So for a small dog or a cat, the one-handed compression, fingers underneath the chest, the thumb on top, and a third of the chest cavity is what you want to press in on. And that's 120 compressions per minute, or the staying alive beat. A little bit bigger dog that you can't get your hands around, that's where you can interlock your fingers and go underneath when you set them up. So underneath, right behind the ribs, and pushing in on both sides. Bigger dogs, laying on their side. This is where you lock your hands and elbows and use your body weight. Right behind the elbow in Labrador or Golden Retriever sized animals, and compressing like that. That's about 80 a minute.
So it's a little bit slower.
A little slower. 80 to 100. And there's no real, I mean, in an emergency situation, you're going to be counting, but it's going to be an exciting thing that's practiced before, so you know what the rhythm feels like. And then the giant breed dogs, Great Danes, huge dogs that have the big barrel chested, you're looking for the widest point of their chest, where they're the thickest, because it's going to be very difficult to actually get to that heart. So going over the widest part, and this is where you'll have to use your body weight to get that third of the chest width compression.
Gotcha. Now, we always talk when we're doing compressions on the human that there's a chance that we might break ribs. You
Absolutely.
might hear noises, you
Right.
might hear, but that should not deter them from stopping.
Right.
Because we can fix those. We need to
Absolutely.
get the heart
Right.
going
Right.
again.
Circulation and
So
breathing.
the same thing, if you're compressing, chances are, I guess, if there's you might, but it's you probably wouldn't have too much force.
You're probably more likely, if you're doing a full compression in the smaller dogs, it'd be easier to break a rib.
Okay.
That's why we don't want to do this on live, healthy animals.
Sure.
But you can survive with a broken rib. You can't survive without a heart that's beating.
Correct. So they should expect the same thing.
Absolutely.
That, okay.
You may break a rib.
But you keep going.
You keep going.
Okay.
And there are a few things that you can look for as far as efficacy, how effective your compressions and respirations are. Looking at mucous membrane color. It's
Okay.
pretty easy on a dog. Well, in most dogs, unless they have black gums, and then you can't see anything. But looking at their color, okay. Typically, dogs that are unconscious and not breathing, they're going to be cyanotic. They're going to be whitish, bluish, purplish colored.
Okay.
When you're providing,
And that's around.
you're going to just lift the lip up and
Just
look at the
lift the
gums
lip up?
mhm,
Okay.
under the teeth, or adjacent to the teeth. That's a gauge that you can look at to see if you're having any effectiveness. We should see, what we want to see is bubblegum pink.
Okay.
That's good. That's good airflow. That's good oxygen flow, oxygenation of tissue. Compressions to respirations, the ratio. 1 breath per 15, or if you've got somebody with you. If you've got somebody else that's breathing for you, they breathe every 15.
Okay.
If it's just you, best probably to do 30 to 2. So 30 compressions to 2 breaths.
Okay. So we start with 5.
Start with 5.
Start with 5 to kind of assess.
Right. Get oxygen in the lungs,
Get oxygen going.
and then you start your compressions.
And then you do the compressions. So you can do 15. If we're doing this together,
Right.
we're doing 15 to 1 breath, or you're doing the breath because,
Yeah.
it's your dog. It's your
Right.
dog, right?
Right,
So
right.
you do the breaths, I'll do the compressions.
Right.
However, if I'm by myself, it's 30 compressions to 2
2
breaths.
breaths.
Okay.
Yep.
This will help, but primary, you got to get to the vet.
Go.
And you made a comment before, you don't have to go to your own
No.
clinic.
Go.
So you want to go to, and I say that because I know that there's multiple clinics around, but if you have a rapport with somebody who might be on the other side of town,
Sure.
you can shoot into the closest.
Right. Yeah. All veterinarians are trained in this. We do this often.
And just because this isn't your patient, you're not going to say no.
No,
It's an
absolutely.
emergency, so you're going to
Absolutely.
open your doors.
And in a clinic that you walk into and saying my dog's unconscious and not breathing, they're going to usher you back, and they're going to take the dog from you and go to the surgery suite or wherever they have oxygen and intubate and start the CPR.
All right. See, that wasn't rough at all. I know. But thank you very much.
Oh, you're
I
welcome.
appreciate it. This
Yeah.
is something that a lot of people ask, and,
Absolutely.
and we're great to help. So
Absolutely.
there you go. Dog CPR for all those that are interested. Thank you for watching.